Hi, everyone, and welcome back to the Cabral Concept. I'm Stephen Cabral, board-certified naturopathic doctor. Excited you could join me today on our first of two Cabral HouseCalls. Every weekend, we go through our community's questions, everything wellness, weight loss, anti-aging, and of course, everything is in between, as you'll see today. So really amazing questions, as I've been saying over the past month or so. Remember, we're about 10 weeks to 12 weeks behind on getting to your questions, not because we want to be that far behind, but because there's so many questions coming in to Ask Cabral that what I would like to do is always say, many of the questions that were asked today, I'm going to just kind of point them out. Some of these questions are just best and easiest served by going to the Facebook group, which is cabralsupportgroup.com. Literally, you can join for free. It's called Dr. Ball Detox Group, but it's just a support group. And you're welcome to ask questions right there, and we can get back to you pretty much the same day. And remember, my team, when they don't know the answer, they ask me, and then they'll answer your question right there for you, like which is the best type of lab test, all those different things. So it's just one more resource we're trying to provide. And of course, I will continue doing the Ask Cabral house calls on the weekend because I very much enjoy doing them, and I enjoy being able to kind of give back to many people that I may not get the chance to speak with in person one day. So I want to spend our time together answering these questions. So let's get through them. Let's get through, let's say 10 questions today. I really want to get through at least 10. So that's going to be my goal, all right? So the first question is from Lindsay. She's writing in, "Hello, Dr. Cabral and Staff. I'm a third-year naturopathic medical student at Bastyr University, and I'm writing to see if Dr. Cabral would be my mentor. I'm certain he receives requests all the times, but I will tell you that mine is unique. I'm married with 3 young children. My husband and I gave up a comfortable life in Colorado because we saw too much preventable suffering in the world around us and wanted to promote and make our life about helping others get well. I, like Dr. Cabral, motivated to reach the masses, not because I am chasing wealth, but because I have a sense of urgency to reach a broad audience so that I can help people who are suffering before it's too late for them. I would love to be able to observe in Dr. Cabral's clinic or work with him directly. Thank you so much for taking the time to read this message, and thank you even more for all you do each and every day to help people in need." Lindsay, thank you very much for your request. We do appreciate that, of course. I am not able to work with people yet. In the future, I will do in-person days, but I'm not able to do that right now, simply because of time. If you saw my calendar and you saw my schedule, it's hilarious because it's all color-coded of when I'm speaking with people through Skype, when I'm seeing people in the office, when I'm doing an interview, when I'm recording a podcast, when I record video, when I'm doing the curriculum to write up the curriculum for this fall certification. So it's pretty intense. And then I also have to carve out my time in there as well. So the full day is just not able to be done because I want to always serve in the best way that I can. And I would not be serving you if you came in for the day because I'm just devoted in so many different areas and I wouldn't be able to be as focused on you. However, I do mentorship every Tuesday afternoon for 3 hours. I speak with health practitioners, whether they be personal trainers or looking to start their own health company, doctors, acupuncturists, you name it, from all over the world. And I might have one spot left. It's usually booked up months in advance, but you're welcome to always email my team, and you can email them at support@stephencabral.com. Again, you could post this in the Facebook group if you wanted to. So sorry, you wrote this in on March 7th, and of course, remember, I only see the questions when they come in. That's it. Like I just see them when they, not when they come in that day, but when it's time to read them for the house call. But you sound like you're doing great. Bastyr is an amazing naturopathic university. And absolutely, it sounds like we have a lot of synergies. I know you're going to do great things. Would love to help if I'm able to. Certainly would love to do that. And of course, our health certification is also coming this fall, where we'll be teaching people to practice exactly like we do, whether it's online, considered like telemedicine in air quotes, or telecoaching, however you want to say it. And then just exactly like in person or online, because I know a lot of people want to do more of the online work anywhere in the world type practice, which is great as well. All right, Michelle's up next. Michelle's asking, "I just heard Dr. Cabral on Joyce's Plant-Based Nutrition Summit. She mentioned that Dr. Cabral healed his Addison's disease. My little Spitz Terrier dog, Spooky, about 16 pounds, has had Addison's for 4 years. I'm wondering what Dr. Cabral did to cure his Addison's, and is it translatable for dogs? I gave Spooky a monthly 6 ml shot, basically prednisone. I hate putting him through this type of medicine and would prefer to do it the natural way." All right, Michelle. So there are certain things that I actually work and I just help people. I don't see animals in my practice, although I love animals. I really do. But I refer out for holistic veterinary medicine. So what I recommend everyone do is to look up a holistic, you can just type that in, HOLISTIC HOLISTIC, holistic veterinarian, and you can just type that into Google and look for a holistic veterinarian in your local area. Because what I'm going to recommend is you're obviously going to have to stay in touch, and that's the only way you heal from these things is, again, anyone that enters into our private practice knows that it's 3 appointments. So we don't just do one and then, okay, you're on your own. So what I recommend is actually working with a holistic vet, and they'll send you on your way. I've given recommendations for cancer-based protocols for dogs since I had a dog with cancer. And obviously it's very traumatic if you're someone that loves your pet, that you don't want to see them suffer like that. So I don't do any veterinarian-based work, and so I would refer out for that, and I would look for a holistic vet. I hope that you find what you're looking for. Since I've always had dogs, I've always had boxers, and for the last, how many years now? 14 years, I've had French Bulldogs, and I love my French Bulldog Moose. So yes, I hope that you get care for your dog. All right, Kate is up next. Kate's asking, Dear Dr. Cabral, quick question, is the fruit and vegetable blend safe to take in pregnancy? I'm working with a functional medicine doctor who has recommended some supplements, but I would like to add this in addition. So Kate, the daily fruit and vegetable blend is okay to take during pregnancy, but of course, you'll have to make the best decision for you. For my wife, I'd have no problem with her taking it. It's 22 organic fruits and vegetables, a little bit of an antioxidant from basically the skins of grape, and just powerful antioxidant, all natural. So absolutely okay by me, but it has to be okay by you. Remember, so every single nutritional supplement pretty much in the world that you'll see, just to tune you in, we have to write under cautions, do not use if pregnant or nursing. That you just have to write that. Like that's one of those things that's just a kind of an FDA thing, but it's good advice, meaning like you do have to be careful, and you should be careful of what you put in your body always. But of course, if you are literally bringing another life into this world who's just developing. So I feel very comfortable having my wife use it, and my children use it. I use it every single day, but of course, my kids get a much smaller dose. They get a quarter of a tablespoon rather than the full tablespoon, but it just goes into their smoothie anyways. So hopefully that's helpful, Kate. And yes, it typically will not interfere with any other supplements because it's all food-based. It's 22 organic fruits and vegetables. So great question. But again, this one in the future, questions like that, ask it right inside of CabralSupportGroup.com. You'll get an answer that day. All right, Stacy's up next. Dr. Cabral, do you have a test that will check for H. pylori in the stomach? I've recently been diagnosed with a stomach ulcer, and since I rarely take ibuprofen or Aleve, I don't consume alcohol on a regular basis, I read H. pylori can be a factor. Also, can underlying stress cause an ulcer or enhance the symptoms of an ulcer? Thank you for your help, Stacy. Stacy, you are right on all accounts. So H. pylori, yes, typically the infection in the stomach. It can be caused by alcohol. It can be caused by too much Advil, ibuprofen, any of those. I know that you're not taking those, so could it be caused by stress? Yes, an ulcer can be caused by stress or H. pylori. Both of those are absolutely factors that wear away the mucosa, the mucus level of the stomach, so that when your body naturally produces acid, it can actually cause an ulceration, or we call it ulcer, of the stomach lining. So yes, we run the stool test by biohealth. They have 2 different companies. Anyway, we'll link it up in the show notes today. Just go to StephenCabral.com/855. Yes, that is exactly what we do. Honestly, you can do an endoscopy, so you can have a little camera put into the stomach to look at if there is any type of duodenal-based ulcers, or, I mean, of course, there can be ulcers in the gastric part of the stomach, but you can also check for an H. pylori-based infection. We do something called a 3-day stool test. It's the best stool test that I know of. It catches things when a lot of others don't, and that's because it's a 3-day sample instead of a 1-day sample. It looks at parasites. It looks at bacterial overgrowth like E. coli and Klebsiella. It looks at H. pylori, parasites, ova, worms, all of those. It's a phenomenal test, really. It's one of the best. I use it all the time in my practice. All right. Hopefully that helps. And again, we'll link up the stool test today. Deborah's up next. Deborah's asking, thank you for all you do to help people live a better and healthier life. My grandmom-in-law has atypical leukemia. Her doctor started her on chemo. She's been struggling with Hashimoto's for years, low energy, thyroid problems for decades. She has cellulitis in the back of her thighs, back, ankle, and stomach. She's sensitive and has adverse reactions to medications. How would you help her rebuild her immune system that she's under? What info do you need to be able to help my grandmom? I believe you can help her horrid disease. The doctors don't know how long she has to live. The best they can hope for is her body will go into remission and she will live for 2 more years. I hope to see her live for another 15. I look forward to hearing back. I've submitted this question to the support group, and they gave me some good suggestions, but I recommended submitting to the house call as well. Okay, Deborah, that's the way to go. Submit it to the support group, and then submit it to the house call if you want. Okay, so a few things. One is that there's different natural protocols based on whether your grandmother is going through chemo or radiation, or if she's done with it, right? Because if she's done with it, well, we can start to rebuild the body, and we can actually do some liver detoxification. But if she's going through chemo and radiation, then we're not actually going to do a detox at that time. So it really depends on where she's at. If she's under chemo or radiation or radiation, then we're going to use a lot of the same protocols that they talk about at cancertutor.com. And I've given this recommendation before because honestly, for me to talk about cancer on a 5-minute house call answer is not appropriate. It's not ethical and it's not moral, nor would I do that. So what I recommend is going to cancertutor.com. I would look to see the absolute best treatments from a natural perspective on leukemia. I'll tell you this, we are always trying to boost the immune system and not destroy it. That's what we do in natural health. So we're trying to get the body so strong that cancer can't live inside of it. So that's what we're doing. We're doing a lot of greens. We're doing a lot of juicing. We're doing intermittent fasting. If a person's strong enough, we're using certain B vitamins, maybe even something like vitamin B17 if there's any tumors. I know you said that she has leukemia, so that might not be the recommendation as well. There's just so much great information there, and that's why I just recommend really starting to read books on cancer, such as Gerson Therapy, Tripping Over the Truth, The Doctor Who Cures Cancer, like Definitive Guide to Cancer. I have a whole bookshelf just dedicated to cancer. The Truth About Cancer, like literally, Cancer Curing the Incurable. I've read, I can't even tell you, 20, 30, 40 books just on how to, we have to call it cancer support, so how to help support the body when it has cancer. Of course, I'll do more shows on cancer in the future. I just know that I'd be doing an enormous disservice by doing a small little podcast on how to help someone recover from cancer. But if you go to cancertutor.com, it's kind of like a reference site on everything. It's very, very impressive. And then I would recommend reading some of the works by Dr. Nicholas Gonzalez, by Dr. William Donald Kelly, who was Dr. Gonzalez's mentor, essentially, and The Definitive Guide to Cancer by Dr. Diamond and many others. The Doctor That Cures Cancer by, I'm trying to think, it wasn't Emmanuel Ravicci's work, but it was a author reporting on Emmanuel Ravicci's work, I believe. So I've read Emmanuel Ravicci's 900-page book on basically curing, but I'm using that in air quotes, cancer, but that is not like a regular book. It's a pretty intense medical book that is just, I'd rather you read The Doctor Who Cures Cancer rather than that book. You'll get a lot more out of it. So hopefully that's a good place to start, and I wish you the best. And I remember, keep hope, right? Start doing meditation with her, walks outside, detoxification, saunas, Epsom salt baths. Have her read The Rain Barrel Effect, using that de-stress protocol. All of those things will be super, super helpful. Okay, Josh is up next. Josh is asking, my sister is a 40-year-old mother of 3. She can't seem to shake some pesky stomach weight. After visiting multiple specialists, committing to a personal trainer, doctors have told her that she has diastasis, and the only way to get rid of her stomach flat again, is to get plastic surgery. Is this true? Well, Josh, this is a great question, and we work with many prenatal women that are pregnant and postnatal as well, helping them get their body back to the strength, the shape, the posture, how they want it after they are pregnant. Because actually, it's really, really important that you exercise after pregnancy, after the 4 to 6 week mark. Here's why. Well, one is to help with diastasis. A lot of people who don't know what diastasis is, it's the separation, essentially, of the rectus abdominis. So it's important to look at that. It's basically the abdominal wall being opened up a little bit. And that's kind of normal in many pregnancies. And that's because you have to be able to expand, we'll just call it the stomach-based area for lack of an easy way to say it. So that's not uncommon. What's uncommon is that it does not go back after a period of 6 weeks, 8 weeks, 12 weeks maximum. So here's the difference though, Josh. If your sister can pinch like a lot of belly fat, subcutaneous fat we call it, that's not having to do with the diastasis, all right? If her belly is protruding, that could be because of the diastasis. All right, so there's two things. One is you can simply look up online. It's very, very easy. I've talked about this before. You can go to stephencabral.com/podcast and type in diastasis, and you'll actually see, I believe I linked to a video, but you'll see exercises that help to strengthen that abdominal wall to help repair the diastasis. However, if there is too large of a separation, there might need to be surgery to repair that. It's possible. I mean, it is possible. So I'm not going to deny that. And again, my job is not to say that one form of medicine has to be the way it is. But if it's belly fat that we're talking about, well, that's a different story. And what I would like her to look into is cortisol levels, her levels of sleep, doing something like a 7, 14, or 21-day Dr. Ball detox, of getting into even a plan such as our elimination diet or fat loss diet plan, any one of those things, just to make sure that her nutrition, her exercise is on point, that she's doing 3 through 4 days a week, that she's keeping lower glycemic foods in the beginning, all of those things. So again, kind of going back to the rain barrel effect and following those 8 specific protocols. And if you can pinch the belly fat, okay, that's a different story. We're going to look at cortisol, we're going to look at insulin levels, blood sugar, and we're going to burn that belly fat. Now, if it's a protrusion, if it is literally what looks like almost like lordosis, right? The kind of the back is swayed, the stomach sticking out. Well, then you will look into whether that has to be surgically repaired. So Josh, I know it's kind of a roundabout answer, but I think I gave you the answer by seeing if it's subcutaneous body fat or if it's been more than 12 weeks, is it able to be repaired without surgery? And so you'll look into that. And if your sister is doing the diastasis-based exercises to help kind of re-strengthen the core and rebuild that abdominal wall, then the answer might have to be surgically repairing that. But I'm going to let you look into that with your sister. Okay, Kelly's up next. Kelly's asking, when I was a teenager, my doctor said that I had a condition where my red blood cells were irregularly shaped, and I would always need to take iron supplements. Is this considered thalassemia? I frequently have low iron levels on traditional blood tests, but have never had any other low results, like low oxygen binding capacity. I used to take iron pills regularly, but then read this can be dangerous and lead to iron overload and brain issues. Over the past few years, I stopped taking iron. I have puzzling symptoms such as dizziness, nausea, shortness of breath, panic attacks, heart palpitations, and rare fainting. Although these symptoms may sound overwhelming, I'm absolutely functional, but I consider myself highly sensitive and aware of bodily changes. Do any of these symptoms correspond to untreated anemia? I've tried to balance out my calcium, magnesium, sodium, potassium through my own mineral supplementation. If I take iron pills and never have too high iron on blood tests, is it safe to say I'm at no risk for iron toxicity or overload? Thank you, Dr. Brawl. Okay, Kelly, these are really great questions. And I don't think that I've talked about thalassemia before, so I'd love to talk about that today. There are essentially 3 main types of thalassemia. And although I don't see it a lot in my practice, I actually saw it quite a bit before. And the reason is that there aren't a lot of practitioners that actually look at your blood under a microscope, but I used to do that for about a half a decade to maybe about 7 years under an electron microscope because I was trained in that and I found it very, very helpful. And we could see the misshapen blood cells. And so then we could say, oh, okay, let's run this test and run this test. So thalassemia is essentially a condition where we have this misshaped cells, body's not able to use iron properly, but that's not the only type of anemia. So I want to talk about that today. But people who have thalassemia actually are at risk of iron overload because of the inability to really process it in the cells so it can be floating around in the blood. So you have to be really careful, but you'll simply run your ferritin levels, your total iron binding capacity, and you'll run other markers to look to see if there is iron overload. And at the same time, you run a full CBC, complete blood count, and you'll look at your MCV and MCH and MCHC and like all of your different means corporal. You'll want to look at all the hemoglobin, basically, is what I'm saying, in the cells, right? You want to see if there's any form of anemia. If there's not, well, then you're doing okay. You're doing well. So there's different types. I'm not going to go through all of this today, but you can look this up. There's thalassemia minor, there's thalassemia beta-based, and then there's alpha-based. And depending on what you have, it depends on the severity. So right now you might be doing absolutely fine, but it sounds like you may have some of the issues of thalassemia, which is the kind of shortness of breath, the dizziness, the nausea. But check that out because, like you said, it absolutely could be just, why don't you check your blood pressure as well? So meaning like the symptoms that you have are also from low blood pressure or low blood sugar. I would love you to buy a glucometer. It's like $20 on Amazon. And Omron blood pressure meter. You can literally go to stephencabral.com/podcasts and type in doctor's office. I did a podcast on how to create your own home doctor's office. The I gave you the thermometer that I use at home with my own family. I use the one in my practice. I give you the blood pressure monitor. I give you the glucometer, literally everything on that show. So check that out, because you could simply be doing too much of one of your minerals, causing you to feel lightheaded, and you might have too little of another. You could run a hair tissue mineral analysis, and that would give you that result as well. Now, keep in mind, another form or other forms of anemia might be low copper, and it might be low B vitamins, then as well as low vitamin C. So again, check your blood work every 6 months to make sure you're doing well. And then if you do have iron overload, be careful about the high iron foods that you're eating, and definitely be more or go more plant-based. So hopefully, Kelly, that was helpful. Let me get in one more question today. I think we may have hit our 10 questions. The next question is from Lance. Lance is asking, hello, Dr. Cabral. I understand that you have multiple years experience in musculoskeletal strengthening, alignment, and mobility exercise. A few of my coworkers have replaced their office chairs with exercise balls. We sit multiple hours a day documenting on our computers. They say only good things about the switch. I'm skeptical, and I've been doing my research on the idea. I see arguments from both sides. As realistic as I am still torn, what are your thoughts on the potential benefits and complications that can be caused doing this? Okay, Lance, really great question. And this is coming in on 3/9. Again, I wish I could get this to you sooner, but this came in on March 9th. All right, huge benefits from using an exercise ball during the day. What are the benefits? Mainly strengthening the core, okay? If you are more cognizant of how you're sitting, you're going to sit more upright. Here's the deal. The way that you sit upright on an exercise ball is by rolling backwards, which puts your body into what's called the posterior pelvic tilt. That means if you look at your hips as a bucket of water, if you tilt them backwards, the water spills out the back. You don't want that. Then you go all the way forward, and if you tip your hips forward, you spill the bucket of water. That's called an anterior pelvic tilt. You don't want that either. That starts to tighten your lower back muscles and really tighten the hip flexors. So what you want to do is you want to find the middle ground between a posterior pelvic tilt and an anterior pelvic tilt, and that's called a neutral posture or spine. That's what you want. Being on an exercise ball can be tremendous for that, but here's the downside. On an exercise ball, you want to make sure that it's at the proper height for your computer, so you want to buy the 55 centimeter or the 65 centimeter for most people. If you're 5'6" or below, you'll get the 55 centimeter typically. And if you're 5'7", 5'8" to 6 feet, you'll get the 65 centimeter ball, blow it all the way up. And your knees basically, the way that you'll know you have the right ball, your knees are basically parallel with the hips. When you're seated, your legs are basically at a right angle. And if you're over 6 feet, you'll probably want a 75 centimeter ball. So the downside is that a lot of people still lean on their desk. A lot of people overarch their back when they're on an exercise ball to compensate to not have to use their core muscles. Okay, what does that lead to? Again, tighter psoas muscles, tighter hip flexors, tighter, the muscle is called a TFL muscle on the side of the hip as well. It's also a hip flexor. And this leads to tighter lower back muscles. So if you're going to use the exercise ball, use it for how it was meant to be used. And that's using an upright posture. It's strengthening the core. In the beginning, you may actually want to use both your chair and the exercise ball, alternate back and forth until your core is strong enough to keep you there all day long. But it can be tremendous, Lance. It really can. And so I recommend it. Here's a hybrid that I found to be nice, is that you buy the ball without the base, and then you also buy the base for the ball. Now, what is the base? Well, the base actually prevents the ball from moving around. So you literally use it like a chair. The ball sits on the base. You don't need to stabilize anymore moving around on the ball. And yeah, it can be really tremendous. It really can. So here's the deal. You're still seated though. And when you're still seated, the hamstrings still get tight. The hip flexors still get tight. And so you still do have to stretch those at least once or twice a day. Hopefully that answer was helpful. Thank you for writing in, each and every one of you today. Appreciate it. Appreciate all of your listens. And we've gotten so many new reviews on iTunes over the past week. I can't thank you enough for that. I literally read every single one. If you have not left a review on iTunes yet, if the Cabral concept is helpful, I would truly appreciate you leaving one. It can literally be like 2 or 3 words, and 5 stars never hurts. Thank you so much for tuning in. Really appreciate it. Please always feel free to share this show with anyone you believe it could help. Take care. Since I was a kid in college, I'd always dreamed about being able to teach people how to take control of their body and mind so that they could live the life they'd always dreamed about. I wanted them to experience the energy, drive, ambition, and passion that comes when your body has the right nutrients in everything from your nervous system to hormones to brain is balanced on all levels. And about 8 years ago, I got to start living that dream by providing as a resource the highest quality nutritional supplements and lab testing in the world. Today, we've taken it to a brand new level by formulating third-party tested functional medicine supplements that are unrivaled in the marketplace. We also provided direct-to-the-public functional medicine lab tests that were previously only available when you went to your functional medicine doctor's office. I believe being able to make your own decisions and take control of your own health and body is the future of medicine, and that time is now. This is why I invite you to check out our brand new functional medicine home over at equilibriumnutrition.com for its grand opening, where you'll find updated searchable categories by ailment, brand new products, and state-of-the-art at-home lab testing. Plus, for the next week, we'll be offering 10% off store-wide in celebration of this brand new online home, where you'll find all of your previous functional medicine favorites and lab tests and nutritional supplements, as well as over a dozen new products to check out. Our whole team is excited about the new online store, brand new faster shipping time, and we look forward to hearing your feedback. Now head on over to equilibriumnutrition.com to take advantage of our one-time grand opening sale. And remember to enter the discount code TAKE10 at checkout to save 10% store-wide.